Hi, I'm Mike Boyce, the Chairman of the Cobb County Board of Commissioners, and with me again today is Dr. Janet Memark from the Cobb and Douglas County Public Health Departments. And it's been about 100 hours since I spoke with you last about the arrival of our passengers out of Dobbins, and they're now with us, a little over 200 of them, and they're under the operational control of the Department of Health and Human Services. But a lot of other things have happened out here in town. I think this is now a timely occurrence to bring you up to date on where we are and what we're going to do to let you know that your public health is our number one priority right now to take care of you. We currently have about 8 cases of this virus that is being hospitalized, and the CDC has increased their standards for the population that we believe is most vulnerable to this virus. And that, of course, probably as you well know, is the elderly. So we want you to know that if you have any kind of a chronic medical condition, if you have liver disease, if you have a heart issue, if you're undergoing cancer treatment, you have immunotherapy drugs that you're taking right now, you're at risk. And we want to encourage you to stay home. And if you develop any symptoms, we want you to call your provider, your health provider, and Dr. Memark will talk about that here shortly. But the most important thing is I want to emphasize right now is that if you're a senior and you have any kind of a chronic medical condition, I really encourage you, out of the best interests of your family and yourself, to stay home. If you have grandkids, the interesting thing about this virus is that the children may not manifest this virus and the symptoms of it, but they can easily transmit it to you, even though they don't know that. So if you have grandkids, grandchildren, be very careful around them and let them know that you love them, but why it's important you have some social distancing while we get through this time. There's just a number of events that we'll be looking at right now, but if there's any large gatherings out there, particularly sports events, we had a book sale scheduled for this weekend and we're going to be postponing that. Things of that magnitude, we want you to stay away from those. We want you to be calling your pastors at your church, asking them what their policy is, if you're a senior, about attending services there. And I know there's a deep spiritual base here in this county. And so I'm just asking you here to work with your pastor to make sure that we all get through this time right now. So with that, I'm going to turn the floor over to Dr. Memark. She's got some other information that'll be most useful to you about this time. Dr. Memark.
Thank you, Chairman Boyce. I want to reiterate what the chairman has said about our higher risk groups. Remember, 80% of people are going to have very mild symptoms, but the people that we're most concerned about are our elderly or patients that have chronic medical conditions like heart disease, lung disease, diabetes. Those are the people that we're worried are at more risk for having severe symptoms or even death is a possibility. So please be mindful of that and think of the things that the chairman has told you about. So remember, if you are ill, please stay at home. Do not go to school and do not go to work. Other things to think about is if you have life-saving medication that you are on daily, make sure that you kind of reach out to your healthcare provider and ask if you can get a little extra supply just in case if we have a little bit more widespread illness and you don't want to be going to the drugstore or the grocery store. Remember to wash your hands. I keep telling people to do that. And think about non-essential travel. So that includes cruises or non-essential airplane travel. These are things that are not being recommended by the CDC at this time. I know there's a lot of anxiety about COVID-19 at this time, and we're experiencing extreme amount of phone calls. So a lot of people are going to start meeting people or know people who are being asked to stay at home because they've had contact with a patient that's had COVID-19. This is something that is expected, right? Now, the questions that we are getting is not the people that are being quarantined at home. We're getting questions about the contacts of the contacts. So remember, the person that needs to stay at home is the person that was in contact with an active case patient of COVID-19, not a contact of a contact or a contact of a contact of a contact. You are at general risk and should just wash your hands and stay home when you're ill, those kind of things. But you don't need to be quarantining or being overly concerned about that kind of condition. Another thing I really want to talk about is if you develop some symptoms, so maybe you did have a risk or you're concerned about a risk or you're just feeling ill, please do not walk into the emergency room, into your doctor's office, or the health department. You need to call and see what your health provider wants you to do. Many times at this point, if you're having mild symptoms, they're going to ask you to stay at home and do what's called supportive care, which is just kind of get through your symptoms like a normal cold and you'll be fine. But if you have severe symptoms at any point, please make sure that you get care from a healthcare provider or emergency. If you have any other questions related to COVID-19, please visit our website. I know the phones are very, very packed right now, but you can go to Cobb and Douglas Public Health. We have a lot of information and links for you to reach out to. In the meantime, please heed the CDC recommendations and protect yourself and our community from COVID-19. Thank you.
Okay, well, thank you, Dr. Memark. That's really great information. And I just want to, it's an important role of government officials to provide assurance to the public. And I realize right now that since the last time I talked to you, the level of anxiety is probably ratcheted up. And I get that part, because like I said, we're out there in the community with you. But I just want to say a couple things, hopefully that'll give you some idea that there are so many elements right now working for you. First of all, I am in daily contact with the White House, executive branches of the government, the state of Georgia, HHS, which is here on the ground at Dobbins, and of course Dr. Memark and other agencies. It's amazing that the phone never rings twice. We are all connected right now, and we're all talking with each other. And that includes the Cobb County School District. I had a long conversation with Chris Ragsdale today, and there's a couple of things that I think they're important right now, is that we're starting to see how this community is tied together in ways that we didn't realize before. For instance, while I'm having suggestions that we close the senior centers, the reality is that there are a number of seniors in this county who go to the senior centers to get their meals. So if we close the senior center, then they're prevented from getting some of the meals. The school system has the same issue. There are a number of children who receive their lunch there at school every day. So these are the kind of issues that we're struggling with at our level, but we're going to get through them. The second thing is that we're going to be having a special call meeting of the board on Monday to discuss additional measures. And what has triggered this, of course, was the first known case of a school being shut down here because of a COVID virus among one of the members of the school system. That means that all the measures we've been taking here to try and prevent this COVID virus from spreading, they are having some effect, but there's still some that are getting through and affecting a large population. So we need to step up our game too. So behind me you see the staff. A lot of them are the same people you saw here on Sunday when we did our last video. And they're going to be working through the weekend to provide options on Monday morning that the board will consider to start addressing the prevention, slowing down the spread of this contagion. We need to now start putting a Board of Commissioners face on our approach to this. Obviously, with the late breaking information on Saturday night, I had to step into the role to fill in some of the gaps. But now it's time to bring all the team together, both the staff and the board, and we're going to be doing that on Monday morning. The last thing I want to emphasize here is that we're going to get through this. I really believe that. I was at a men's recharge breakfast this morning, and I don't care what spiritual faith you have or what your belief system is here. Now's the time for prayer. The COVID virus now has, they're in this game too. They're on this side. We have that as our known opponent, and we need to bring in all our resources together to try and bring the community together so that we can speak with one voice, that we know what the challenge is here, and we're going to get through this because we are Americans. And as you all know, I've been going out among the community for the last 10 weeks, knocking on doors, talking to people, and I want to let you know that I'm hearing great things at the door, that they have confidence that we're going to get through this. We are a privileged people in this country, and we're privileged to have the kind of leaders we have in this community, both in the government, in the school system, in the nonprofits, in the business community. We're all talking together here, and I want you to know that we have your best interests at heart. So I want you to take a look at the phone numbers that are on this on the screen that will be passing through here. We're going to be standing up our Emergency Operations Center. You can contact us here at the county, and if we don't have the answer for you at the time, we're going to get it for you and we'll get it back to you. But there's websites here that the government's put out. We have a contact number if you have any questions about what's going on at Dobbins and those passengers out there. There's a phone number for that. But I want you to know that one of the ways we're going to get through this is we start talking to each other, and we keep talking to each other. So again, thank you for being Cobb. Thank you for having trust in this government. Thank you for having trust in what we're doing for you. And we're, by partnering together, you've given us the feedback of what it is you're hearing out there. Together, we're going to get through this. So let's band together here, and may the Lord continue to bless us in all we do here. Thank you very much, and we'll be doing this update on a regular basis.